Good morning, I'm Jan Rail and I'm the interim director of the Fairfax County School of Nursing, where we have 3 separate programs, and I invited some students today to be able to tell us a little bit about these programs. So I'm going to let you introduce yourself.
Hi, I'm Catherine Morgan. I am a senior at Lake Braddock High School, and I am currently taking the Introduction to Nursing course.
Okay, Catherine, and tell me what you're learning in the Introduction to Nursing course.
So in the Introduction to Nursing course, we are focusing on learning the basics of patient care and how to make sure patients are comfortable. We've been focusing specifically on long-term care units and the focus of more elderly people. And we have also started learning about infection control.
I think the entire world knows how important infection control is in these times. And tell me, Catherine, what is it you plan to do after you graduate from our program?
I plan to hopefully graduate your program with a CNA certification and then go on to nursing college to earn a BSN and graduate as a registered nurse.
Great, thank you for joining us. So one of the things that I can tell you is the Introduction to Nursing course can be taken by either an 11th grader or a 12th grader. If you take it in 11th grade, you can progress on to the next course that we're going to tell you about. And that course, we have another student here to tell us. Can you tell us your name and where you go to school?
My name is Ashley Michello. I'm a 12th grader at Falls Church High School, and I'm taking patient care technician.
Okay, and Ashley, patient care technician, I noticed what you were doing there. Will you tell our viewing audience what you were doing?
So I was doing passive range of motions. Basically, I was moving his muscles in his elbows so that they wouldn't be wasting away and they would still be using their muscles even though they're in bed. It's important because we don't want your muscles to waste away while you're in bed and while you're immobile.
Okay, good job. And tell me, what are your plans after you graduate?
My plans after I graduate is to have a certification both in CNA and PCT, which is patient care technician. And I plan to go to college to get a BSN in nursing, and then later on in my life to get a DNP.
Oh, wow, thank you. You're gonna have more education than your instructor does. I have my bachelor's degree from the University of Virginia, but I do not have, nor do I plan to get a doctorate of nursing. So the next program that we teach here is very near and dear to my heart, as it was my entry level into nursing. I graduated from a practical nursing school. So can you tell us about you?
My name is JC. I'm a senior at Just High School, and I'm taking practical nursing.
Okay, JC. And tell me what you're learning in your program.
We're learning about the fundamental bugs and the autonomy bugs. In the fundamental bugs, we're learning about how to take care of the pectins, and in the autonomy bugs, we're learning about the blood and how the body works and how the heart works. And this week, we're going to learn about respiration.
Excellent. And you're planning on becoming a practical nurse in next August. It won't be too long. Thank you for joining us, JC. So we have these 3 programs. One, you can start as an 11th or 12th grader, and that would be Introduction to Nursing. At the end of that course, you would be able to sit the Certified Nursing Exam. Certified Nursing Assistant exam. In that course, you learn the basics. How do you give a bath? What's the proper way to wash your hands in medical care? How do you take a blood pressure, pulse, those sorts of things. If you pass that course, in 12th grade, you can take your patient care technician. In patient care technician, you review the things you learned as an introductory student, and then we proceed with EKGs or electrocardiograms, to trace the electrical activity of the heart, and then also phlebotomy, which is drawing blood and starting IVs. Those 2 courses you could take independently and not progress on to anything. Then the 3rd course is practical nursing. That was my entry level into nursing. Once you take that, you are going to take the NCLEX test to become a practical nurse. With any of these courses, though, you could graduate from the course and enter right into the work field and never have to take another class. Patient care technicians right now are making in the $22 an hour range. For the CNAs, about $17 an hour range, and for the practical nurses, about $25 an hour range, just to give you an idea of what you could make when you're out of school. So please talk to your counselors and join us over here, either at the Falls Church Academy. I will tell you that West Potomac and Chantilly also have these academy courses. Thanks for joining us.